Hi friends, welcome back to our channel. Now we are with Dr. Explain about the university, country, culture, thing, what she is doing in the hospital and what she is teaching to the student. Everything will be explained in this video. If you are a 12th ongoing student, if you are a NEET aspirant, please watch this video fully. It will be very useful for your MBBS career. She is all the way from Georgia. Madam is a neurosurgeon doctor from New Vision Hospital. She is a lecturer in New Vision University. Welcome, India, madam. You have some words to our future doctors and the people who see the video.
I'm happy and honored to be your guest and to be able to meet future doctors with bright future and brilliant minds. And I'm a neurosurgeon, as you mentioned. I'm the youngest female neurosurgeon in the country. I'm also pursuing PhD degree both in neurosurgery and educational science. So I'm here as a neurosurgeon and as an educator as well, lecturer who teaches the future doctors in the New Vision University. This is what I do for the job. So I drill patient skulls in order to get to the brain and to the lesion located inside the brain. Georgia is a beautiful country nestled in between Black Sea and the Caspian Sea. With
Black Sea, Caspian Sea.
Yes. And we're part of the large European family. And the first Europeans were actually the remnants of the female and male skull were discovered first in Georgia, very close to the city of Tbilisi, which is the capital city where our New Vision University is located and where I teach and do neurosurgery. And the name of the Georgia is linked with the St. George and the one that defeated the dragon, as well as the more romantic of the version of the name comes from the Persian, the land of the wolves, but we call our country Sakartvelo. We have 11 regions and beautiful seaside as well as the mountainous side. You can enjoy all the views, as well as we have 1 out of 14th in the world, the alphabet, which is Georgian unique alphabet writing.
Very beautiful country, madam.
This is the capital city, Tbilisi, the views from old Tbilisi, the seaside city Batumi, and you see here the Katri pillar where you can only reach by
Batumi is a city.
Yes.
It's near to Black Sea.
Yes.
They have the sea transportation.
Yes.
And Tbilisi is an older city.
Yes.
Yeah,
It's
ancient city.
Ancient, yes. And even older Tbilisi is the old capital, Kutaisi, which is located in the western part.
Kutaisi.
Yes, Kutaisi. In our weather, it's important to stress that you can experience both summer and winter in one day because we're protected from cold in the north with the major Caucasian mountains and from the heat of the south from the minor Caucasian mountains. We have a lot of caves. Promethean cave from mythology is, and the deepest in the Georgia Krubera is also. And we have a lot of stories and tales and legends of the bravery of our ancestors. And then comes into play the daughter of the king Medea and the Cupid. She falls in love with this prince, and she's actually the very first healer that is mentioned in the history because she had this magical garden with the herbs that could put to sleep the dragon even. And they fled with the golden fleece. The beauties of Georgia continue. This is the canyons of Martvili that you should visit once. Crybaby Mountain that it rains the entire day.
Georgia is a very beautiful country.
Yeah.
People in Georgia are also very, very beautiful, like you.
Like Black Sea and Caspian Sea. Our tradition of winery is worldwide. We recently celebrated 8,000 years of winemaking. 8,000 years, and this is and to honor the 8,000 years of history of winemaking. And our national dishes. I know that nothing compares to the spices in India, but we also have some dishes that we're proud of. Yeah, Khachapuri.
Khachapuri, yeah.
Different regions, they have different take on the same food, khachapuri, in different styles. You can taste this one in the seaside, and khinkali, which is the famous Georgian dish as well. And these are churchkhela. These are taste like with walnuts and nuts and the grape juice. And our hospitality is known worldwide. And I can assure you that the students coming to Georgia will feel like it's the second home, because they're gonna spend at least 6 years in our country, and they're gonna feel like this is the second home for them, because our hospitality, we take guests as the gifts from the God, and we worship this sort of cult of guests.
Tamilnadu hostel is also there. Yeah.
Yes.
Very good hospitality. Yeah. We have hospital in the college and very good hospitality in the college.
Some famous Georgians, who, by the way, we won the match between Portugal and...
How you say, how are you in Georgia, madam?
Rogorahal.
Rohorahar. Okay.
Wow, they sound really
Yes,
good.
our viewers are Rogarahar. I am fine means how will you say?
Kargat.
Kargat.
Oh.
Kargat. Yeah, I am fine. Like that they
But
will.
the major thing is like we say hello. Salam. We're in
Salam,
city
salam.
of Salem. It's Salam.
Oh, salam. In Tamil Nadu also, India also say salam.
Yeah.
It's like salam alaikum. They'll tell.
Yeah, gamar joba is the word, like when we meet one another.
Gamar joba. Yeah, gamar joba. Say hi.
Like may your day, like may you be a winner. Like it means the it's a
how you
blessing.
say I love you in Georgia, madam?
It's a difficult. I
am committed, madam. You are so beautiful, but what can I do?
Come on, nerd. Your sense of humor is on top.
Thank you, madam. Thank you.
And our university, that we recently celebrated 10-year university. And during this short amount of time, in the span of 10 years, our university has achieved unimaginable height. And these are we are treasure the sustainable development of our university, and these are the rankings that we're really proud of.
You are spending more time from there, coming here and seeing your students, seeing your past students, seeing the future students. So it will be very good, madam, because many universities are there. But the university person coming India and seeing the people is quite unique. So the people who seeing the video, they know about the importance of the university. So we will have some more number of admissions for our university. New Vision is not an ordinary university; it's a world-class university. In Tamil Nadu, many colleges are there. Now the standard of this university is very good comparatively. Yes.
I completely agree with you, sir, because we have our own hospital in which we can give the education, not just the education that is a conventional, but also clinical practice, which is important because for future doctors, for the future clinicians.
Tamil Nadu ex-CM Jayalalitha, Richard Pillai from UK, coming from there to India to do operation.
Yes.
He's from UK doctor. Overall, the world, two stream, UK and USA stream. India follow the UK stream. Many UK people are studying in our college. Our colleges are in UK also. New Vision.
Yes, we have our branch in United Kingdom, and our professors are one of the best and at the top of their fields. And I'm proud to share our companionship. We have our insurance, we have our own, as you can see, hospital and health hub, and now we will have our own cinematographic school where we're going to teach with according to the European standards, and this is the new campus for cinematography. We are reaching new and new heights every year, and to have more and more students dedicated to the future to perfect the world of healthcare, and their goal to be to care for the patients and to have the best possible outcome for the not just for their personal but also for the good of the benefit of the mankind as well. Our students have the hands-on experience, and before they experience them in practice with real patients, that we have simulations where we teach on the cadavers how to perform the procedures.
So we have cadavers.
Yes,
but
animal models. We have animal models. In here, you can see that I'm teaching my student how to perform ventriculostomy, which is one of the most common procedure neurosurgeon will do during the residency. It's putting a tiny catheter, like the pen catheter, inside the ventricle, inside the brain to drain excess fluid. So they are first performing it on the cadaver, on animal models. and learning all the tricks and tips. And then they go into the actual OR where they can see such a unique cases like you see here with dealing the tumor growing from meninges. And we take them step by step. As a neurosurgeon, I take them step by step, starting from the correct positioning of the patient, how to perform the incision in the right way, what are the anatomic structures they are cutting and they're getting into. And I demonstrate this is the video taken by the student who is present on the real life surgery, on the real patient that is performed. And you can see that here in the video that I'm explaining the procedure as performing in the real life, in real time. You see the drilling of the brain, drilling of the skull in order to get to the brain, and the excision of the skull. This is called procedure called craniotomy. In order to access the lesion, okay. Yes, remove. It's the oldest procedure. It was performed in the ancient civilization, and it was believed not just to treat the patient, but they also had a spiritual meaning because they believed evil spirit lived inside the skull and they would create a hole. So there are ancient Inca civilization in Peru. They found the skulls with the trepanation in it. But this is the medical procedure that allows us to access lesions located inside the skull. We call it intracranial, or inside the brain. And you see the bone flap was removed to access the brain itself. And we also teach that opening of the skull is important, but closing it in the right way is important. The accumulation of CSF under the skin, and we had to reoperate. And this is the bone cementum, and these are the titanium screws that we fixed this new skull for the baby. And these are my students. Without this, there would mean no footage. They take part. They are like the real role models.
Which year? Fifth year?
Fifth year. Yes, I have younger students, but usually fifth years are the ones that scrub in. They get to participate in the surgery. And these are the younger. So we see patients
They came
together.
India, passed FMG.
Yes, this student graduated last year, and she passed this year the exam. Yes, yes. And for other students to learn that she had such a
she passed in
high
FMG.
scores. Yes.
Yeah.
And there are many students who achieve what they want when they come back, and as well abroad when they go to United States, or whether they go to and we do rounds in the clinic. We see the patients, we ask the questions, we gather up the information from genetic background, and they participate in the diagnosis process, because by asking the right questions, they can actually gather information that will help us to go to the right diagnosis, because right diagnosis is the ultimate goal, because the half of the process is diagnosing the disease and the other half is treating, right? If you have the right diagnosis early on, you can
easily capture the disease
on spot, and you can have best possible outcome.
Because now diagnosing itself a big first of all, go to doctor, give tablet, eating, sleeping, okay. Now full body test, half body test, this test, then disturbance, then only finding, after that going inside operation.
Yeah.
Big deal. Yeah.
Sometimes that's also the way. Yes.
Yeah.
And here you see the fifth year student. She was not expecting. She was crabbed in, as you can see. And I handed the instruments. I said, "Go on, go ahead. You can do it." And
she's
then
India.
yes,
Yeah.
and she did it. She did it
Tamilnadu.
well. Yes. And here you see that we're.
How you allow the fifth year student to do operation?
Not the operation, but the closure, stitching.
Oh, closure. Okay,
Yes.
okay. They will learn about
Yes.
by. So you give many practice and making him perfect.
But they are practicing on the. They have models.
I'll tell you. In India, after studies only clinical, but there while studies itself clinical is going on. Yes, super, madam.
And also we have discussions, open discussions, like panel discussions, where we have specialists from different fields and the students can ask any question they're interested in. And we have topics which are really important. And in last week's discussion, we discussed Alzheimer's disease and dementia, which is one of the most common cause of elderly loss of cognition. And we had the open talk. We discussed the state of art of medicine and also the future perspectives. And they gave us their thoughts about it, and we shared our experience and insights with them. So they can approach every lecturer, every professor with the questions directly, and we are there 24/7 to solve
Their
any
issues.
yes,
Super, madam. More than a lecture, you are local guardian for the student also.
Yes.
Who come from India. They are taking care of very good in Georgia. From India, if you are seeing Georgia, it is Georgia. If you are going in landing in airport, it is Georgia. Going in road, it is Georgia. When going to our university, it is look like Tamilnadu. All Tamil peoples.
Yes.
Yeah.
They feel like home in our country, and they feel safe because some of our surgeries last 8-9 hours. And when we concluded the surgery, it was really late, and like I was worried for them to get back, but they answered, "It's Tbilisi, ma'am," so they are not scared to walk even in the dark hours because they feel safe and they feel welcome there.
So many people from India, India MBBS fees is too high. And the people in India, 1 year, one subject fail. Again pay the fees, 25 lakhs. Again said the same year. Next year fail. Again the same year. In Georgia, it is credit system. So it is easy for the students to clear it. And going to the final year, it is not a matter. And moreover, Georgia, our pattern and our exam is MCQ pattern. In India, the next exam is MCQ pattern. So it will be easy for our students to pass the next exam. India is paragraph pattern. It is very tough because the NEET exam is MCQ pattern, madam. This is MCQ pattern. The India 12th very good mark, but NEET low mark because of the pattern difference. Our university have the same pattern, credit system, everything. It will be very useful for the students. And you are telling about the university and the country and the details. If you are not a 12th student, you are not a NEET aspirant, you please share this video to your friends who is studying NEET and who is studying 12th standard, who is in really a dream of doctor, future doctor. You please share this video. So it will be useful for them. If you are a hardworking student, you strive for the brilliance and excellence, we're waiting you and we will welcome you at the New Vision University. So we're looking forward to meet you, our future doctor. Thank you, madam. Take care of our Tamil Nadu students, madam. Very nice meeting you, madam. Nice to meet you. Thank you, friends.